Hepatitis is a general term for inflammation of the liver. Your liver sits in the right epigastric region. It is composed of its functional unit called the lobule, which are composed of rows of hepatocytes arranged around a central vein. The liver plays an essential role in human life because it is a big player in metabolism, among other functions. Hepatitis is most commonly caused by viruses, the ones which we're familiar with, for example, hepatitis A through E viruses, or the lesser known ones like Epstein-Barr virus. It's also caused by drugs, alcohol for example, or chemicals, Tylenol toxicity for example, autoimmune diseases, and metabolic abnormalities. Let's take a closer look at the different types of hepatitis viruses. Hepatitis is typically acquired in the acute form from viral infection. The virus attacks the hepatocyte, which can result in cell lysis from cytotoxic cytokines and natural killer cells. Cell regeneration and normal functioning may return after acute infections. However, chronic viral infections may lead to a chronic form of hepatitis, which can later progress to cirrhosis of the liver. Systemic effects of this inflammation are from the antigen-antibody complex between the virus and its antibodies circulating the immune complexes. This can activate the complement system and thus the inflammatory cascade. Hepatitis A virus is typically transmitted by fecal-oral route. It has an incubation period of 15 to 50 days, average of 28 days. It is most infectious during week 2, slightly before the onset of symptoms. It is infectious until 1 to 2 weeks after the start of symptoms. Populations at risk include people in crowded conditions with exposure to poor personal hygiene, poor sanitation, and contaminated foods, and people with subclinical infections like infected food handlers, sex partners, and IV drug users. Hepatitis B virus incubates for about 45 to 180 days. It is infectious before and after symptoms appear for about 4 to 6 months. Infected persons are carriers for life. Hep B virus is transmitted by percutaneous or permucosal exposure to blood or blood products, sexual contact, and perinatal transmission. Sources of infection may include needles, syringes, blood products, sexual activity, and contaminated needles for tattoos or piercings. An infected person may also be asymptomatic. Hepatitis C virus has an incubation period of 14 to 180 days, with infectivity lasting 1 to 2 weeks before symptoms appear. The majority of infected people develop chronic hepatitis C and remain infectious. Transmission routes include percutaneous or mucosal exposure to blood or blood products, high-risk sexual behavior, and perinatal contact. Populations at risk include people involved and exposed to infected sexual partners and needle users, and people with HIV. HDV incubates for 2 to 26 weeks with infectivity at all stages of infection. HDV is usually a result from HBV infection, so HBV carriers are always at risk of HDV. Sources of infection in populations at risk are the same as HBV. HEV has an incubation period of 16 to 64 days, but the infectivity period is unknown. It is speculated to be similar to that of HAV's infectivity period. It is transmitted via fecal-oral route and is predominant in outbreaks associated with contaminated water supply in developing countries. Populations at risk include people exposed to contaminated water and poor sanitation, typically found in Asia, Africa, and Mexico. It is not commonly found in the U.S.
Clinical manifestations of hepatitis include signs of jaundice due to bilirubin not being metabolized and increasing blood serum levels. Dark urine and ascites are also symptoms. Ascites is third spacing of fluid in the peritoneum. Arthralgias, paresthesis, myalgias, and pruritus are the most common extrahepatic signs of hepatitis, and less common is hepatic encephalopathy. The subjective signs are nausea and right upper quadrant pain at the site of the liver, joint pain, loss of appetite, weakness, and fatigue. Joint pain is a common symptom because hepatitis C stimulates an autoimmune response that can manifest itself in your joints. Common lab result changes in hepatitis include high serum aminotransferase elevations, which is a liver enzyme study, where the AST is greater than the ALT. Altered PT-INR clotting times are common because the liver produces all the clotting factors for the body. Elevated bilirubin levels greater than 1 milligram per deciliter are common, as well as low albumin levels less than 3.5 grams per deciliter. Elevated ammonia levels with hepatic encephalopathy greater than 45 micrograms per deciliter occur.
So collaborative care for hepatitis is going to mainly focus on allowing regeneration of the liver and allowing the body to rest. That's going to involve adequate nutrition to prevent anorexia and weight loss, mainly in the case of hepatitis B. Drug therapy is going to involve the use of interferons, protease inhibitors, and nucleoside and nucleotide analogs. Supportive drug therapy is going to involve drugs like antiemetics that will help with nausea and vomiting that are caused by the virus. Involved in collaborative care is also drug therapy. To be more specific, the use of interferon. There are two different drugs. There's the standard interferon, which is a short-acting drug, and pegylated interferon, which is a longer-acting drug. They both work to block the viral entry into the cell, block the synthesis of viral proteins, and the viral assembly and release into the body. There are many side effects. The most common are confusion, headache, dizziness, fatigue, blurred vision, nosebleeds, anorexia, abdominal pain, increased liver enzymes, nausea, vomiting, alopecia, and dry skin, also cough and dyspnea. The adverse effects can be pretty serious: homicidal or suicidal ideation, ischemic disorders, colitis, hepatotoxicity, pancreatitis, leukopenia, and thrombocytopenia. As far as nucleoside and nucleotide analogs, they also inhibit the reproduction of the virus in the body, although it doesn't inhibit all of the virus from reproducing. Those side effects are fatigue, headache, hepatomegaly, neutropenia, myopathy, and peripheral neuropathy. The adverse effects involved are, the only one is lactic acidosis. As far as protease inhibitors, they are going to result in they're going to have a direct antiviral effect. The side effects of that are also fatigue, headache, unique is urticaria, nausea, dysgeusia, diarrhea, vomiting, anemia, and neutropenia. Adverse effects are angioedema and hypersensitivity reactions.
Possible nursing diagnoses related to hepatitis include imbalanced nutrition, less than body requirements, related to physiological factors of being unable to properly absorb and metabolize food, as well as biostasis. Deficient fluid volume would be another, related to failure of regulatory mechanisms with manifestations of third spacing and vomiting or diarrhea. Another would be risk for infection, related to inadequate secondary defenses and malnutrition.
The complications of hepatitis include acute liver failure, chronic hepatitis, cirrhosis of the liver, and hepatocellular carcinoma. With acute liver failure, hepatitis B is the second most common cause of acute liver failure. The treatment of choice is usually transplantation. However, early detection and treatment of the virus is key to preventing the complication. Chronic hepatitis is mostly caused by hepatitis C, and it's most likely to become chronic. The people involved are more likely infants and children Infants acquire this from the mother during the pregnancy, and patients with chronic kidney disease, and I believe that involves the decreased immune cellular response. Cirrhosis of the liver is the chronic inflammation and necrosis of the cells resulting in fibrosis. So that treatment involves slowing the progression of the cirrhosis, but again, as with the other two, with acute liver failure, prevention and early treatment of the virus is key in preventing complications. For hepatocellular carcinoma, it's usually caused by cirrhosis secondary to hepatitis C. Usually cancer cells from other parts of the body are carried to the liver through the portal circulation. Again, prevention focuses on identification and early treatment of the hepatitis virus.